Thank you for all being here today. We're going to talk about allergies and natural healthcare solutions. Anybody notice how bad the allergy season's been this year? It's been horrible for most people. It's been terrible. We've had patients come into our office that never had allergies or minimal and just suffering really, really bad this year. So maybe it was the dry weather. Hopefully we're starting to get a little more rain now, but it's a big thing. And we're going to talk a lot about different type of allergies as well today. So for those of you who don't know me, how many of you have been here or here for the first time? Oh, okay, well, welcome. Again, we do this once a month. We've been doing it for years right here in the library. The library has been gracious enough to allow us to use this room. They do limit it to 40 people because of the fire code, I guess. But anyhow, this is who I am. My name is Dr. Podlaski. I'm licensed in Florida in chiropractic medicine, but I also have a naturopathic medicine degree, a medical degree, and I've got a bunch of board certifications in clinical nutrition, internal medicine, functional medicine, and my office is located right here in the Villages and the Santa Fe Professional Building, right on County Road 466. A lot of the information that I'll talk about today is in a book that I wrote with a friend of mine called Unleashing the Physician Within. And one of the quotes I like from the book is, if you treat your health today, you won't have to treat your disease tomorrow. So think about that as we kind of go along. And then also, I have to give a little disclaimer. The information I'm giving here today, I'm not here to tell you to stop taking any medication that your doctor has prescribed for you. But I am here to give you some information, maybe some things to think about differently. And so I have to give this little disclaimer because we're not going to talk about the latest, newest drug that's out there for allergies. And that keeps our friends at the FDA happy, and my son, who's an attorney, keeps him happy that we're giving disclaimers about things like that. So maybe some of the things I'm going to talk about today are a little different than what your doctor or your primary care, your allergist or whoever, or Dr. Google or your neighbor, doctor next door has told you about allergies. So I just hope everybody has a little bit of an open mind about things today. And another quote I like is, if you don't make time for your wellness, you may be forced to make time for your illness. So think about that as well. So in our office, we talk about functional medicine, functional nutrition, and really the difference is in conventional or traditional medicine, obviously people go to the doctor for their symptoms. Your nose is running, your eyes are itchy, you have a headache, you're tired, all kinds of different things. And we look at symptoms. But just like an iceberg, the symptoms are just kind of above the surface, but the real danger lies below the surface. Things like lifestyle, what you're eating, what you're drinking, what you're exposed to environmentally. Even genetics can have a role to play in things like that. So with functional medicine doctors, with functional nutrition, we recognize the importance of all these factors that go together to really give what people have when they come in for symptoms. So a lot of times people go to their traditional doctor, but they're still having symptoms, they're still having problems, and they don't feel so well. And part of that we find is that people do what they're supposed to be doing, but again, they don't feel well, they feel there's something missing, something else I could be doing that I'm still having the issues I'm having. So we call that being part of the walking wounded in the healthcare gray zone. Again, you're doing what you're supposed to be doing according to what your doctor's telling you, but you know in your heart there's something missing there. So it can be very, very frustrating for people at times when that situation arises. So you're not alone. There's lots of people experiencing the same type of thing as you are. And part of it is that when people go call up a doctor's office, what's the first question the office usually asks you? What's your insurance, right? Mainly because the doctors have to fit into what's known as the standard of care. And I call it the standard of care affliction. And what I mean by that is that it doesn't matter these days where you go, whether you go to Johns Hopkins, you go to Mayo Clinic, you go to your local doctor, for the same problem, same condition, you're pretty much going to get treated the same way because that's what the standard of care is. And unfortunately, a lot of it has evolved to mean, what's your insurance going to cover? What insurance do you have? What tests will be covered or what tests won't be covered? So here's you with all your health problems, conditions, challenges. And part of it too on the doctor is the doctor has to fit into what we call the doctor's payer box. In other words, your doctor has to make Medicare happy, whether it's your Advantage plan or your HMO or PPO or whatever, in order for them to get paid for the services that they have. And if they're not following what these guys require, they can have problems, or they're not going to get paid for their services, for the treatments that they do. So a lot of times things are not covered that the doctor would like, the test or the treatment or whatever. So again, doctors who think outside the box in functional medicine, functional nutrition, look at more things like not just what your symptoms are, but your diet, your lifestyle, nutrition, your exercise, how much water do you drink every day. Those are all important things to end up treating the patient correctly. So what we talk about oftentimes is, why do you wait till you're sick enough to get a diagnosis? Sometimes you can get help without having that critical diagnosis, but that's kind of the mindset of the healthcare system these days. We need a diagnosis in order to do a treatment. And part of that, what's wrong with the standard of care, and this is something I found from Medicare itself, care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary and therefore not payable. Does that make sense to anybody? A quick example of that would be Medicare would rather pay $100,000 if you have a heart bypass operation than a couple $100 a year, so you don't need the stupid thing in the first place. But that's kind of where we're at with that system. So basically, the doctor will be with you in a few minutes. He's got to figure out what diagnosis goes with your insurance, kind of summarize that. And the other thing about that is that according to the government, the only legal treatment for a diagnosis or disease is a drug. That's what the standard of care is. You come in with your symptoms, doctors run some tests, we get a diagnosis from your problem, and the only thing that we can do to treat it from a traditional standpoint is which drug is going to fit that diagnosis or that disease. And the reason we know that too, have you ever looked at the bottle of any kind of nutritional supplement, herbal supplement that you may be taking? And the FDA disclaimer that is required on all nutritional supplements is, these statements have not been evaluated by the Food and Drug Administration. This is not intended to diagnose, treat, cure, or prevent any disease. So it kind of tells you where the mindset is as far as standard traditional healthcare in this country. So the problem with that is that a lot of people are on medications and they don't want to be taking them, or they don't want to be taking increasing amounts of medication. Hassle dealing with allergy medications and all the side effects, drowsiness, headache, there can be a bunch of things with that, and maybe getting worse. And many of the over-counter allergy supplements now we're finding actually contribute to cardiovascular disease, to dementia and Alzheimer's, especially if you take them on a regular, everyday basis. So let's talk about specifically today about allergies. And what we know is that many allergies, many diseases are related to actually undiagnosed allergies that people have that they're maybe not even aware of. And sometimes when these allergy problems are not treated, it can lead to more complicated situations, again, like cardiovascular disease, kidney disease, things like that. So it's estimated between 35 and 50 million people in the United States have some kind of allergy problem. Most of us probably fit into that category. I know a lot of times when people move down to Florida, welcome to Florida, and now you have allergies, depending on where you come from. So an allergy basically is defined as an immediate or a delayed adverse immune system reaction to certain substances that you're exposed to, and these are known as allergens or antigens, just kind of a definition right there. And then when you're exposed to allergens, people that are allergic to something or sensitive to something have an immune reaction. And basically, I'm not going to get real deep into the woods on technical terms, but a couple of things we need to understand about the immune system is that you have different type of immunoglobulins in your body that protect you from foreign invaders, whether it's antigens, allergies, foods, chemicals, pesticides, bacteria, viruses, whatever. So the immediate reaction that happens is that your immune system produces something called immunoglobulin E, IgE, and that's causes your body to release histamine. That's why people often run to antihistamines, because they have this histamine reaction to different allergic symptoms that they may have. So there's a bunch of different allergies. We're not going to go through every single one of these today, but you can see it ranges anything from food to mold to pollen to smoke to environmental pollutants, even medications that people take. So often the trick for people is to figure out what is the thing that's really giving me the problem. Is it that food I ate? Is it something I've been exposed to? Is it that cleaning agent I use at home that's now all of a sudden I'm having symptoms, or I've had them for a long time and maybe nobody's ever really figured out what's going on? So a lot of the symptoms, especially when it comes to food allergies, one of the first symptoms that people experience is kind of an itching in their mouth, or they may get itching on their skin and they wonder, okay, what's going on? Or your eyes may itch, something like that. And then when the food goes from your mouth into your stomach, into your digestive system, you may get other symptoms: vomiting, diarrhea, pain, cramping, gas, bloating, things like that. And then after it leaves your stomach and gets into your bloodstream, some of the allergens may cause other problems for you. For example, it may cause your blood pressure to change. One of the most common symptoms I find with patients when they eat something that they're really sensitive to, they start to notice their heart is pounding, or their heart starts to race, or their blood pressure goes up, or they get a headache or something like that. That's your body's reaction. You just ate something that maybe wasn't really a great thing for you to be eating. And then it also, once it gets into other areas of the body, it can get into your lungs. You may have problems breathing, coughing, and even allergens can affect your joints. You eat something and a day or two later your elbow hurts, or your knee hurts, or your back hurts, and you wonder what happened here. I didn't really do anything. And we'll explain about why that happens in a minute here. So even skin rashes, things like that. So again, allergies can cause, when they reach your brain, then you can have brain fog. Anybody have brain fog ever? Lots of people have brain fog, and you're wondering what's going on. Headaches, even hallucinations. Believe it or not, some people, when they eat things like gluten or dairy products, the protein that your body tries to digest from those foods breaks down into a substance called casomorphin, which is like a morphine-like substance. So it makes your brain crazy. Believe it or not, it can give you this morphine-like effect on your brain. It can even give you visual problems, so you don't feel so good when that happens. And if it gets really bad, you can develop what we call leaky brain syndrome. But leaky brain really starts from leaky gut, which we're going to talk about that in a few minutes. But all kinds of neurologic symptoms can develop from allergy-related symptoms that maybe your doctor hasn't put the two things together, but maybe you have yourself and you're not really sure what to do about it. So different things, including some severe things like schizophrenia, bipolar disease, seizures. We've seen that with patients eating gluten. One reason we do a whole talk on gluten, and we're not going to go into great detail on that today, but sometimes even just simple things like eating toast every morning or eating a bagel every morning can create some problems for people and give them a whole bunch of things, including brain fog. So how do allergic reactions really work? So an immediate true reaction, and there's a difference between an allergic reaction and a hypersensitivity. So a true allergic reaction basically involves, again, IgE. That's the first line of defense that your immune system has, releases immunoglobulin E, IgE, and basically your body produces a particular protein that works against this specific food. So you have a food-specific antibody that your body produces against what's called an allergen or an antigen. And then the IgE also causes the release of something from mast cells, which are part of the white blood cells, to release histamine. That's your body's normal response to an allergen or sensitivity that you may have. However, some people develop what we call mast cell activation syndrome. They have an overabundance of histamine that's produced. And instead of a little reaction, maybe a little runny nose or itchy eyes, they break out in rash and hives, and they get a really bad headache or migraine. The brain fog is horrible. And that's actually something that can be tested for. We often routinely check patients who come in with hives and allergy symptoms that nobody else has been able to figure out. And we look for things like elevated histamine in the plasma, or your red blood count, or we look for something called tryptase, which is a particular type of enzyme that's elevated off the chart when somebody has mast cell activation syndrome. So sometimes we have to look a little deeper to figure out what's actually going on with people. So this just kind of represents that, all the different allergens that people can have. and all the different allergic symptoms. Now here's something that's been shown up in the news recently. Anybody hear about this alpha-gal thing? Okay, it's there. And it's a real thing, and it's actually not new. It's been something that's been going on for quite a while now. I've been aware of it for years and years with patients, and I've had a few patients with it. But basically, alpha-gal is a rare allergy that's triggered by getting bit by a tick. And the news reports are that the tick population has exploded recently. We're not going to get into the whole conspiracy thing about why that's happening, but it's a real thing. And with this alpha-gal, basically what happens is the tick bites you, and the tick releases a certain type of sugar into your bloodstream. Now, most mammals have this product, this sugar called galactose, alpha-1,3 galactose, but humans don't. We don't have it. So when this, and it's usually the Lone Star tick, but we're also finding it's some other ticks now that are also causing this reaction in people as well. So the bottom line is, if you get bit by a tick that releases this into your bloodstream, very often what happens is now you become sensitive to other mammal tissue, like you can't eat beef anymore. You can't eat lamb anymore. There's certain things that you can't eat. Now, chickens are okay, and fish is okay, and usually shrimp and scallops and things like that. But people who love beef, and they have this bad reaction to it. And it may happen anywhere from 3 to 6 hours after eating something. You go out and have, let's say you got bit by a tick 2 weeks ago, and sometimes with tick bites, you're not even aware of it. Not everybody gets that red bullseye rash that they talk about, but sometimes you can get bit by a tick just walking in your backyard. It doesn't have to be deep in the woods. And then all of a sudden one day you go out to a restaurant, you have a steak for dinner, and 3 to 6 hours later, you've got some major problems, and you wonder, okay, what is going on here? So, real thing, there's no traditional medical approach to it, but there is a technique that is an acupuncture technique that actually I've signed up to try to learn this technique. It's a doctor in Maryland that puts an acupuncture needle in your ear, and it takes about 6 weeks, but he has over a 90% effectiveness in getting rid of this problem for people who have been bitten by a tick. The problem is he's got so many doctors wanting to learn this. Now I'm on the waiting list, so we'll have to see what happens. But anyhow, it is a real thing. It's not something that's just hype. It's been around for a long period of time. So a food allergy basically is an abnormal response to a food that's triggered by your immune system. That's kind of the summary of that. And a true allergic reaction, you've probably heard about people who eat peanuts and all of a sudden their throat swells up, they have to rush to the hospital, they can't breathe. That's a really emergency. It's called an anaphylactic reaction. Now, sometimes a reaction to food is really not a true allergy in the sense it's not IgE mediated, but there's other immunoglobulins that react in the body too. And oftentimes we call these food intolerance or actually food intoxication. And I'm going to talk about that in a couple of minutes on what that means and what the difference between a real allergy is and either a hypersensitivity or a food intolerance or intoxication. So there are a bunch of different symptoms, obviously. This is kind of a summary of all the different symptoms that people may have when they have allergic reactions, including trouble sleeping or falling asleep, dizziness. A whole bunch of different things can happen like that. So let's break down the different type of allergic reactions. So again, the first one is called an immediate IgE response. That's something that may happen within a few seconds to a minute after you eat something that you may be exposed to. But it also can be seen in things like pollen, weeds, soy, peanuts, corn, things like that. So that's an immediate reaction. It may happen anywhere from a few minutes to 4 hours after you're exposed to that substance. And again, that's IgE, that's the body's immediate response. And that really is what we call an anaphylactic reaction. That's the real serious stuff. Now, there's another type of category of allergic reactions or sensitivities that are called delayed hypersensitivities. And in all honesty, most traditional allergists only focus on these. They don't even consider those, the delayed ones. So what that really means is that in a delayed reaction, you may not have a reaction anywhere from after 4 hours to 72 hours later, 3 days later. So let's say 3 days ago, and it doesn't have to be something that we typically think of it as an allergy, like peanuts. It could be something healthy, like carrots or celery or something you ate, and 3 days later, all of a sudden, you've got hives, or you've got this allergic reaction, and you're wondering to yourself, what is going on here? I didn't do anything. Or your old high school knee injury or back injury has flared up, and you're wondering, okay, what's going on? Nothing really happened, that I didn't fall, I didn't hurt myself. So these are more difficult to identify, because I don't know about you, but sometimes, most of the time, I don't remember what I ate 3 days ago specifically unless I really thought about it. But it could be something you ate a day, 2 days, 3 days ago causing this reaction. So a true allergy, this is an immediate thing, again, IgE, which can cause anaphylaxis. This is where people end up in the hospital because they can't breathe, or it's really serious. And this is really an emergency situation for most people. You have a cascade of chemicals that your body produces, histamine overload, inflammatory cells, and this is really a reaction that has to be taken care of pretty much right away. And the first time somebody experiences this, they know they've got a problem to this particular food or a chemical or whatever it may be. So again, these are some of the most common foods that we find in these allergic reactions. So my point is, there's a difference between a true allergy and a hypersensitivity or a delayed hypersensitivity. And again, there's some common things that can cause these true allergic reactions, including gluten for some people. Gluten in particular is the only, celiac disease is an autoimmune disease, and it's the only autoimmune disease that we 100% know what causes it, and that's from being exposed to gluten, which is found in wheat, rye, oats, barley, grains, things like that. Now, the thing that complicates this whole situation is a situation called cross-reactivity, where the protein in the thing that you're allergic to may be similar to protein in other substances that you weren't even aware of, but your immune system reacts the same way. So let's say, for example, you may have a reaction to shrimp. You know you can't eat shrimp, but you also may be sensitive or have an allergic reaction to crab, lobster, which would be really sad, wouldn't it, for people? But, or other things. So that's called cross-reactivity, where you're getting the same type of allergic reaction to something that's similar, but not exactly the same thing. So that can be a huge problem for people as well. And then when we talk about the non-allergic, again, delayed hypersensitivity reactions, again, that may happen anywhere from 4 to 72 hours, and it can happen to a lot of different things. It can happen in the body. It may be something, maybe you're not allergic to it, but maybe you don't have the enzymes in your body properly to break down certain things, like gluten. None of us really has the enzymes to break down gluten completely, and now that the farming practice and the manufacturers have added 500 times more gluten to the wheat crop and grain crops, we're seeing more and more and more people are becoming sensitive to these type of things. Now, it's not an anaphylactic situation. You may feel miserable, but with the delayed hypersensitivity, you probably won't end up in the hospital, but this is a different type of immune response, IgA, IgG, IgM. And those are things that can be specifically tested for rather than what the traditional allergist does. So again, here's kind of a summary of all this. Immediate reactions, anaphylactic, most severe, and then we have delayed reactions, which a whole bunch of different things can be caused by delayed reactions. Again, something you ate 3 days ago and you may not be aware of. So very often I have patients who come in and they complain, they said, I was out a week ago, I went to a restaurant, and right after that, I didn't feel so good. I had diarrhea, I had gas and bloating and cramping. I must have food poisoning. Well, my question is it really food poisoning, or is it food intoxication or food sensitivity? Food poisoning, usually you don't get symptoms till maybe 2 to 3 days afterwards. It's a bacterial infection. It takes a little while for it to get into your system and to overwhelm your immune system. Food poisoning is that. It's a bacterial infection, and it's not usually an immediate thing. We've had people who come in and say, you know, within 15 minutes of eating that food at the restaurant, I felt sick, I didn't feel well. That's more of what we call a food intoxication. And really what that is, there are certain substances in certain foods that you may be eating that may induce a real bad histamine reaction in you. So that's kind of an immediate reaction to it, but it's really not food poisoning. And unfortunately for some people, this food intoxication or food sense or intolerance can go on for weeks sometimes. And they often say, I'm never going back to that restaurant again. And sometimes it happens from other issues, maybe some of the cleaning agents they use at the restaurant, maybe some of the spices they use. It could be a bunch of different things that can cause this food intoxication or food intolerance. Could be sulfates, just different things. Even on, like, if you go to a restaurant and they have a salad bar, a lot of the restaurants still sprinkle stuff on the salad to prevent it from wilting real fast. So it still looks good, but you may be sensitive to that. And that, again, is more of a food intolerance or food intoxication. And then there's also additives that are added things, preservatives and additives, especially in processed food, that can set up the same type of reaction for people as well, where you have this food intolerance, food intoxication problem. And the FDA set up something called ARMS back in 1985. It was called Adverse Reaction Monitoring System. But these additives and these preservatives, unfortunately, are not just in foods, but they're also in skincare products, cosmetics, shampoo, conditioner. There's a whole bunch of different things. And of course, we know about MSG and sulfites and nitrates. Even some dyes and things like that can set people up for the same type of reaction that's going on. And again, here's just kind of a list of food additives and preservatives, things you want to be aware of in some of the foods that you're eating. What I usually tell people is if it's got more than 5 ingredients, you don't want to eat it anyhow, especially in the processed food stuff, because any one of these things potentially can cause a sensitivity or a reaction. And once you become sensitized to something, it usually means that after that, another exposure makes your symptoms worse. And then another little exposure makes your symptoms worse and worse and worse, until finally people decide, yeah, I can't really eat that stuff anymore, or I can't be exposed to it. And a lot of people kind of figure it out on themselves, but sometimes they have no clue what's really going on. And that's pretty much what happens with certain foods too, as well. That when you eat certain foods that you may be sensitive to, especially if they have toxic chemicals or there's pesticide residue, depending on where you buy it, there is a big difference between regular food and organic and things like that. At least, supposedly, the organic stuff, we don't have the chemicals and the pesticides on it that the traditional stuff is grown. Last month, we talked about how to look at the label on something, on fruits and vegetables, what number it has that it begins with, whether it's organic, whether it's conventional, or whether it's even GMO. And those are really important things as well. So sometimes you may think that you've been doing pretty well with things, but again, certain foods that you eat, and all of a sudden you start developing what's called free radicals in your body. Free radicals are these nasty chemicals that start to cause inflammatory reactions in the body. Your immune system basically is designed to protect your body from foreign invaders, viruses, bacteria, parasites, and again, any type of chemicals or foreign substances that shouldn't be in your body. And as a consequence of that, these foreign substances can produce free radicals, which attack the lining of your blood vessels, which can cause microscopic tears in your blood vessels, and that can lead to a whole cascade of other health problems down the line. So we see this particularly in food allergy in infants and children. Allergy to cow's milk is very common. I know years ago when I practiced up north, I had a lot more babies, infants, children in my practice than I do down here. Inevitably, when they came in with eczema or rashes or even intestinal gas bloating, most of the time the parents were giving them some type of dairy product, cow's milk product, things like that. And especially the eczema can be really, really bad. So one of the things we always talked about is get rid of the cow's milk stuff. And the reason being, we'll talk about this in a second, but we switched them over either to goat milk or sheep milk products. And guess what? The symptoms went away. The problems went away. The gas, the bloating, the cramping. Those of you who have children and remember back to when your babies were infants, sometimes there were some sleepless nights when the baby was not feeling so good and had either diarrhea or cramps or something like that. And very often it was from that. So one of the big things about dairy products, I know it's very controversial, but many doctors, nutritionists, and dietitians still recommend cow's milk dairy for their patients. I don't. I find that dairy products from cows are specifically one of the biggest type of allergens and creating antigens in the body. And why is that? Well, the casein protein found in cow's milk products is very foreign to our digestive and immune systems. I'm sorry to say it, but our bodies, milk does not do a body good. Our bodies don't like cow's milk dairy protein. However, goat milk and sheep milk casein protein is very similar to human milk protein. So our digestive and immune systems are very much more accepting of goat and sheep milk. And that's what I would do a lot of times, even today, with adults that are still eating dairy and all that. It's interesting too that we're the only species that still drinks milk after weaning. Milk is designed to make a baby grow fat and fast and big, and guess what? It does that to you too, if you continue to eat that after your mother has either breastfed you or you've weaned off of all that kind of stuff. So cow's milk contains and the FDA allows this, cow's milk contains up to 59 different hormones, including synthetic growth hormone in it. IGF-1 is a hormone which has basically been studied to show it's actually fuel for initiating breast cancer, prostate cancer, colon cancers. So, milk, my summary on milk is that it also has pesticides, dioxins, herbicides in it, which the FDA allows. So here's my take on dairy. Cow's milk is an unhealthy fluid from a diseased animal. So if you ever have seen commercially raised cows, they're raised in pens, they're always sick, they're injected with hormones, antibiotics. So unhealthy fluid from diseased animal that contain a wide range of dangerous disease-causing substances that have a cumulative negative effect on those who consume it. It's designed for an animal that matures in 2 years, weighing 2,000 pounds with a low IQ. If that's you, go ahead, keep drinking the milk. So here's some healthy milk substitutes that people can often do. We talk about hemp milk, almond milk, coconut milk, goat milk, cashew milk. Even raw milk is actually better because when they pasteurize and homogenize traditional milk, and again, the government hates raw milk, but you're not destroying the enzymes in it that helps your body utilize and absorb it. So there's just some different things that can be done with that. So very often people blame certain things, the wrong things, for their health problems, their weight problems. For example, blaming salt for what sugar did, blaming fat for what refined carbohydrates did. There's a bunch of different things that we have to kind of correct with people about. They think they're eating the wrong things, or they may be eating the wrong things, and they're blaming the wrong thing for their health issue. So those of you who know me, have seen me before, you may have noticed I've lost a little weight lately. I've lost about 20 pounds. And part of it was a challenge from somebody we have a weight loss program in our office, and they didn't believe it really worked. So they challenged me to do it. And I've done it. But I also found that I practice what I preach. I live a very healthy lifestyle. I don't eat junk food. I don't eat any carbs or sugar, bad carbs or sugar. I work out, I exercise. But I still was a little stuck on losing some body fat that I wanted to lose. So I also found out that even though I was eating healthy, there were certain foods I needed to eliminate from my diet. And I have. Here I am, 20 pounds later, lost 20 pounds from eliminating those particular foods and following the program that I have my patients do. So my answer to that person was, nah, I lost the 20 pounds. So it does work. Okay, so here's something that's important too. And this is a really great website. It's called Environmental Working Group. There's the website for it. And what they have is a free app that you can download on your phone. And it basically can cover 80,000 foods. If you scan the barcode, it will tell you if there's any preservatives, allergens, pesticides, chemicals in the food itself, and there's over 1,500 brands. The only drawback to it is if you're going to scan everything you're going to eat, it's going to take you a lot longer to go shopping. But then my point too is you probably shouldn't be shopping in the middle aisle where all the processed junk food is anyhow. But it's a really great resource that kind of rates the food that you're consuming. Obviously, organic is better, but let's be honest, organic is more expensive. Not everybody can afford to eat everything organic. So what I tell people all the time is eat as organic as you can afford to. That's the big thing. If you can afford to eat some things organic and other things you need to compromise on a little bit. There's also, they have a list of the worst offenders. They have the clean 15 and the unhealthy 15. So it can give you a list of the most heavily pesticide-laden products versus the ones that are pretty clean. And here's another thing on their website that I found out recently. Last month, somebody asked me about the water quality in this area, in the villages. And I remember there was a website, but I looked it up specifically for this talk. So when you go to this ewg.org, it can tell you about your water, the tap water that comes out of your faucet at your home. So, interesting thing, they found that there's a bunch of contaminants still in the village's water system. Now, the report says the tap water provided by this water utility, the villages, was in compliance with federal health-based drinking water standards. However, legal does not mean safe. And what they're finding is they can get a passing grade from the government, but that doesn't mean the water meets the latest health guidelines and quality standards. And legal limits for contaminants in tap water may not have been updated in the last 20 years. So here's just a sample of some of the things on their website that was in Village's water. So my point is, you probably should not be drinking out of the tap water from the Village's water system unless you have a really good filtering system in your body, or on your of the water going into your body, and some type of filtering system that you have in your home, whether it's a whole house one or specifically, or even on the shower, because these are some pretty nasty chemicals that they found that were, like for example, this perfluorohexane sulfonate is 3,283 times the recommended guidelines, but they found that much more of it, even though the government certified that the water is okay. It's kind of amazing to me that they allow all these different chemicals to still be in the water and call it safe. But again, we know that there is a difference between what the government says is safe and what really is safe for your body to consume. So you can go to that website, there it is again, and check it out for yourself. I just listed a few of them. There's a bunch of them that they found. And you can go to put any zip code in the country, and the EWG will actually tell you what contaminants may be in the water. So I think that's pretty interesting. Now, the bottom line for a lot of people is, great, Doc, thanks for all the information, but what causes all this allergy stuff? What causes the immune reactions that I may be having? So maybe somebody has a weakened or compromised immune system. Maybe over their life they've been exposed to toxins and chemicals, A lot of people have grown up around a coal burning plant up in the Midwest. Maybe that's part of it. Maybe they have some problems in their intestines, because a lot of problems really start in the intestines. There often can be a genetic predisposition. Not that you necessarily have to have it because your parents passed the genes on, but again, that goes back to what we call epigenetics. What you're exposed to, lifestyle, environment, allergy exposure. And then a lot of people have leaky gut syndrome, which we're going to talk about in a minute or so here, which leaky gut is really the cause of 90% of people's allergy problems. So we'll talk about that. So other things, stress, lower intestinal mucosa. In your intestines, you have a triple layer of mucus. That is where your immune system lives. It's also where your probiotic bacteria live, but it's also where the dysbiotic bacteria live. And then there can be food additives, thyroid function. Yes, your thyroid even can be problems with your thyroid can even be a cause of some of your allergic reactions. And then, of course, we have people that have chronic sinus problems. And the current research on that is that a chronic sinus problem is really more related to having a chronic fungal infection. And a lot of times people don't think about that, or their doctor's not talking to them about that. But this is information been researched by the National Institute of Allergy, the NIH, things like that. Chronic sinus infection lead to chronic inflammation, and that's why your sinuses are always congested, stuffy, and you never really feel well. And even Mayo Clinic talked about this as well. Different type of chemical reactions that happen from the bugs, the fungus that lives in your nose. So the point is also, sometimes even healthy food or things that you think are healthy may be the cause of delayed onset hypersensitivities. And for a lot of people, that creates an inflammatory condition in the body. A lot of inflammation that doesn't go away can really be the source of a lot of health problems. It's kind of like inflammation isn't the cause of it, but the chronic inflammation is the fuel to the fire. It doesn't allow things to calm down. It doesn't allow your immune system to calm down. And that's where chronic inflammation can be a major, major problem for people. So again, it all starts in the GI tract. If you have an imbalance in your intestines, if you have some issues there, maybe you've been eating gluten every day for your whole life, and now all of a sudden you're having allergy problems, or now all of a sudden you're coming up with some autoimmune problem. And basically what happens with that is that it causes inflammation in your intestines. Now, everybody who eats gluten has inflammation in their intestines. It happens to everybody, all of it. About 1 to 3% of the population has celiac disease. That's that autoimmune problem, real severe symptoms, could be intestinal, but it also, one of the most common symptoms of leaky gut is also brain fog. 30 to 40% of the population are what we call non-celiac gluten sensitivity. They get a lot of the similar reaction and symptoms of somebody who has celiac disease, but they don't have the autoimmune disease. And then the rest of the population who aren't celiac or non-celiac gluten sensitivity, again, eating gluten from different grain products causes inflammation in your intestines. The problem with that inflammation is that it causes the cells that line your intestines to start to separate. Right in here, these are a little protein bridge. So the cells that line your intestines are very tight and close together, so nothing can leak into your bloodstream that shouldn't be there, like viruses, bacteria, parasites, foreign proteins like we talked about. But when you've got this chronic inflammatory condition going on, those cells start to separate in your intestines, and now things can start leaking into your bloodstream. That can lead to a condition called dysbiosis. And basically, dysbiosis means that in our intestines we have about 100 trillion organisms, bacteria, probiotic bacteria that live there. 80% of them should be the good, healthy probiotic bacteria. They make hormones, they make enzymes, they regulate your metabolism, your weight. Even the inflammation that goes on in your body can be regulated by the good, healthy probiotic bacteria. When that 80-20 ratio flips around to more of the bad guys than the good guys, It's called dysbiosis. So dysbiosis basically is an imbalance between the good and bad bacteria in your intestines. That can lead to leaky gut. And leaky gut kind of means what it sounds like. Those cells that lie in your intestines start to separate, and now things are leaking into your bloodstream that shouldn't be there. Your immune system, again, designed to protect your body from foreign invaders, starts to go crazy, red flags everywhere. We've got all these foreign invaders. We need to produce all these immunoglobulins and all these other inflammatory chemicals, histamine, to get rid of the foreign invaders. So leaky gut can also cause inflammation in your sinuses. It can cause you to have psoriasis. It can have rashes and eczema, and headaches, and and brain fog, all kinds of things like that that you wouldn't normally think are related to it, but it most certainly is. So how do we figure out about that? Well, one of the tests that can be done, and we do this at our office, is called a urinary indican test. It's a simple urine test that this vial has some chemicals in it, and we pour some of your urine in there, and we look to see if there's a color change. And it can tell us if you've got leaky gut. Now, it's a screening test. It doesn't tell us what's actually causing your leaky gut. But leaky gut, again, can be caused from a number of different things, including foods you're eating, including allergies and pesticides and chemicals, certain medications that you take on a regular basis, like Tylenol and ibuprofen, often can cause leaky gut issues for people. So this indican test can tell us yes or no if you have leaky gut. And then this test called the GI map test, which is a stool sample test, which is essentially looking for DNA from bugs, worms, parasites that may be living in your intestines that you don't know about. That's causing the leaky gut and dysbiosis issue for you. So it's really an important test. Very often we'll have people who will say, well, I've been to the GI doctor, I still have intestinal problems, I have gas, I have bloating, I have diarrhea, alternating constipation and diarrhea. They did a stool sample test on me and they said, everything's normal, everything's fine, we don't know what's wrong with you. Well, that's because they're looking for the wrong thing. In all honesty, the bad bugs that are in your intestines, they live in the lining of your intestines. They don't live in your poop, to be honest. So when they do this poop test and it comes back negative, there's nothing in there. This test is not looking for bugs in your poop. It's looking for DNA from bugs, worms, parasites that may be in your stool sample because they're living in your intestines and causing inflammatory changes. So that's the difference with this particular test. And then we also know that the farming practice in the United States is to spray grain crops, particularly wheat and other grains, with Roundup, glyphosate. And we know that since they've increased the use of that, the reaction that people are having to celiac disease has gone up, to reactions to wheat and bread and other grains have gone off the chart. Wherever you find gluten, you're going to find Roundup. Now, here's interesting too. I have a lot of patients that we tell them, all right, you need to be gluten-free, you're showing up allergic to it, you have a sensitivity to it, and then they go over to Europe, and they go to Italy, or France, or some other place, and they say, Doc, I ate the bread, I ate the pasta, I was fine. Rhoda and I, my wife, did that last year for our 40th anniversary. We went to Europe, and we ate the bread and the pasta. We're both sensitive to that stuff, particularly she is, and we were fine. No reaction, no problem. Why? They don't use Roundup in Europe. They haven't genetically modified the grain crops to have 500 times more gluten in it. And why did the manufacturers do that? Because it extends the shelf life of the products. But it's causing a lot of health problems or health challenges for people. And then the other big thing about Roundup, the company that makes it basically says, well, it doesn't affect humans. And technically it's true, but what they're not telling you is that the Roundup, the glyphosate, actually kills off the good probiotic bacteria that we need in our intestines. So it kills off the good guys, allows the bad ones to thrive. So technically they're right, it doesn't directly affect humans, but if you wiped out all the good bacteria in your intestines, your health would suffer tremendously, and that's another reason why we find this whole issue with gluten and Roundup kind of back and forth together. And it can cause reactions. And so basically, all immune disorders have their roots in allergies, allergic reactions or sensitivities. So to kind of summarize that, what happens in the gut doesn't stay in the gut. It goes everywhere in the body, especially if you've got leaky gut and dysbiosis. And then the other big issue is toxins and chemicals. The government estimates 60 to 90% of all type of cancer is environmentally related. Again, chemicals, toxins, pesticides, the very things that they allow in our food supply. So the government allows over 350 different pesticides to be used on the food that we eat. Is anybody shocked by that? I mean, it's pretty incredible. And then we have hazardous chemicals, 400 synthetic chemicals found in the average human body. So they've done these testing on people, and most people end up with all these different chemicals that maybe they're not even aware of. Where did I get it from? But again, it's in the food, it's in the water supply, household products that we use, petrochemicals, antiperspirants, detergents. So we try to tell people, try to live as clean and healthy life as you can afford to, because we can't avoid it. It's all around, but you can do a lot to kind of limit your exposure to it. And in fact, in California, they have something called the red flag list that anybody can go online and get that. It's called the Toxic Alarm Guide, which can basically tell you what products or what substances, what things to avoid having more of a reaction in your body based on the things that you're exposed to and what you're eating and drinking and what you put on your skin and what you use for cleaning products in your house as well. So we have a little quick toxicity test here. We're not going to go through every single thing, but these are some symptoms that your body is toxic, that you've been exposed to allergens and chemicals and pesticides. So the answer if you look at all these different things, for example, if you're dizzy, brain fog, you have headaches all the time, do you use coffee, candy, or other foods like that to get energy? Do you take Tylenol, NSAIDs on a regular basis? Do you take statin medications because your doctor has wrongly prescribed that for you? But that's a whole nother talk. Anyhow, if you answered yes to 5 or more of these questions, you may be experiencing allergy, arthritis, fibromyalgia, chronic fatigue, because your body is toxic. And it's through all the different things and these toxins accumulate in the body. We do have a pathway for detoxification in the body, but your body accumulates all these toxins, and it's eliminated through different things like your liver and your blood and your lungs and your skin and your bowels and urine and all that. So think of it this way. We have this toxic load that develops over time, and it's like you're pouring water into a glass, and you pour water in and more water and more water, and then it gets to the very top and very rim of the glass, but then all of a sudden it starts to spill over, and that's when people get symptoms. When your body can no longer handle the toxic load that you've been exposed to over the years, again, through foods and chemicals and all the different type of things. So that's why sometimes people will say, I've been fine my whole life. Now, all of a sudden, I'm having problems. Well, it's not all of a sudden. You've been adding to the toxic load year after year after year until finally your body says, that's enough, I can't handle the toxins anymore. And the spillover is basically your symptoms. So there's different ways to test for allergies and sensitivities and things like that. Traditional orthodox allergists, what they'll do is they'll usually do something called a scratch test or a patch test. Now, that only is about 20% accurate, and it only checks for IgE. Those are the immediate sensitivities. So they do that thing on your skin and they look for a reaction, and sometimes they do something called a RAS test. And then a lot of times what happens is the doctor says, well, maybe a couple of things, but you really don't have that many allergies, yet you know yourself you've got problems, you don't feel well, and there's still something going on with you. So there's other ways to do this too. There's other blood tests that can be done that they don't only check for IgE, but again, we can check for IgA, IgG, IgM, IgD, and those are things that we can check beyond just the scratch test. This is actually a blood test, and it can tell us about different antibodies, assessments. Do you have fungus? Do you have yeast? Do you have candida? There's even some specialty things, whether raw or cooked food. I mean, these are things that can be done, don't have to be done on everybody, but if somebody has some serious allergy problems and some serious health problems, and no one's ever been able to figure out what's going on, there are solutions, is what I'm telling you, to get to the root cause of what's causing it. And then there can be other things like a pulse test. That's why I mentioned before. You eat something and within a few minutes your heart is racing, or your heart is pounding, or you're feeling lightheaded or foggy-headed, or your blood pressure goes up. And those are individual symptoms that people have depending on how their body reacts, how their immune system is reacting to the symptoms or to the substance that they've been exposed to. In our office, we do something called nutrition response testing. It's muscle response testing to see how your body reacts to different things that you're exposed to. Basically, it's based on quantum physics. Quantum physics tells us that everything in the universe, including our bodies, produce an electromagnetic field. We're basically looking to see if there's a disruption in your body's electromagnetic field by testing certain acupuncture points on the body called alarm points. Each alarm point relates to a different organ or organ system in the body, and we use your muscles to test the points to see if your body is sensitive to certain foods or substances and things like that. So very often people ask, well, what can I do about all this stuff? I've been to my doctor, my primary, my allergist, and I'm still not feeling good. So my answer to that often is we have to look at a number of different factors. It's not just here, take this Benadryl or take this other Allegra and go on your way, because there's got to be a reason why people are having problems and symptoms. So you have to look at your diet. You have to look at how you're sleeping, your nutrition. Are you exercising? Are you drinking enough healthy, clean water every day? Do you have structural issues? What's the stress in your life? Those are all the things that should be looked at. And if your doctor's not looking at that, then you don't have a doctor, you have a drug pusher, basically, who just wants to give you some symptom relief, and you're out the door. So very often, there's different allergy-related, what we call diets for people. Again, based on what your body, what's found. And that really means a system of removing things, adding things, and balancing things in the body so your body and immune system can function properly. So here's a little quick summary of it. Eat less crap, carbonated drinks, refined sugar, artificial sweeteners and colors, and processed food. And then eat more food, fruits and veggies, organic clean protein, omega-3 fatty acids, and drink clean, pure, purified water, the best that you can. One of the companies I really like for water is called Mountain Valley Spring Water. I don't know if anybody has heard of that. I like it because their water is in glass containers, and the pH is 7.0 to 7.2, which is really perfect for what our body needs. We talk about that in our whole talk on healthy eating for healthy aging, but that's just, I don't have any connection to them other than I like drinking their water. So part of it, to help your body, we need to remove all the excess sugar, the food intolerances that people have, and those are things that all can be checked out. Very often we need to help people clean up themselves, detoxify themselves, get rid of the toxins, the poisons, the chemicals that they've been exposed to. Detox your liver and your gut, toxic organisms that live in your intestines. And yes, they can be removed not by antibiotics, which actually makes your leaky gut and dysbiosis worse. Because one round of antibiotics, whether it's Cipro or doxycycline, will wipe out 99% of all the good healthy probiotic bacteria in your intestines, and it can take you a year or two to replenish the good healthy probiotic bacteria, which get destroyed by the antibiotic. Then adding things back into your body again, the healthier foods, different cooking styles. Yes, I've had some patients who are so sensitive to things that we had to talk about, you need to go on a carnivore diet. You need to eliminate everything else except for eating meat in your diet, or a ketogenic diet, or a ketovore diet. Now, some people may think that's a harsh approach, but if you're miserable and you have brain fog and rashes and hives and you feel sick all the time, give it a month or two, see how you feel. Most of the people feel a lot better when they eliminate all the things that are causing, either they can't lose weight, like I said, that was one of the reasons I lost the weight, is I eliminated things, even though they were healthy. My body said, nope, not good for you. Vitamins, herb supplements, sometimes that's part of the deal too, depending on what your body needs and how nutritionally deficient you are. Other things, breathing, meditation, prayer, movement, exercise, taking a walk every day start out at 15 to 20 minutes a day if you can do that, or maybe even longer. We also talk about body, mind, and spirit. Have some fun. I often ask patients, what are you doing for fun? A lot of people have no answer. I don't know, nothing really. That changes the biochemistry of your body and the brain chemistry and your neurotransmitters, and making things more fun in your life can actually affect your immune system as well. And there's lots of studies that show that. And then balance yourself based on your own biochemical individuality. There was a study done, a book written a number of years ago, biochemical individuality, that basically we know that all of us have 99.98% the same DNA. We're all pretty much the same, but that 0.02% may be why you react to gluten more than I do, or you need more vitamin D than your husband or wife does. That's biochemical individuality. Those are things that can be easily checked to see what your body needs. And then the final thing is you've heard of probiotics, you need to replenish the right type of probiotic. Now, most of the time, probiotic manufacturers are lying to you. When they have on the label how much probiotics in there, they may say it's 50 billion CFUs. The CFU is called colony-forming units. That's supposedly the live probiotic bacteria that are in the product. But that's at the moment it's manufactured. And then it gets transported, stored, and then your stomach acid can destroy most of it. Most of it is that it's a lie. You're not getting the benefit unless you use the right type of probiotic that's either a spore form or it's enteric-coated, so it's not getting destroyed in your stomach, bypasses your small intestine, and gets active in your large intestine. That's why we say, I said before, 90% of all health problems start in the gut, because we call the gut the second brain. The bugs that live in your intestines literally communicate with your brain via the vagus nerve and other chemicals to tell your body, let's eat good healthy food, or the bad bugs, the dysbiotic bugs, tell your brain, eat sugar, eat junk food, or eat all the bad stuff. That's what they crave. So the good healthy ones don't want you to eat that stuff, but if you've got that dysbiosis, that's why you can't get rid of the cravings that you have. So the goal is to get you back to what we call eubiosis, healthy, normal, healthy bacteria, and get rid of the bad stuff. And then, of course, the traditional medical approach to all of these allergy problems is real common. It's what? Antihistamines, right? That's or other allergy medications. Basically, it blocks an enzyme, blocks the release of histamine in your body. But if you think about it, based on everything I've said, is that really the answer? You really want to just block what your normal body's response is to it? And then there's some recent research, one of the studies done at the Indiana University School of Medicine, that said by taking these common allergy medications, over-the-counter medications on a daily basis, you are actually causing your brain to shrink, you're creating cardiovascular issues in your body, and it greatly increases your risk of developing Alzheimer's and dementia. Real studies, real information. Now, this is not taking occasional Benadryl or occasional Allegra, but we're talking about somebody who's got to take this on a daily, everyday basis because they can't function without it. Nobody has looked into the real root cause of what's causing all your allergy symptoms, most likely, and the only answer you've been given is, well, just take these medications over the counter, Zyrtec, Claritin, all that stuff. So there are real consequences of that, and there you can look up the website where you can find out all the issues that they've discovered from these over-the-counter medications. And then, of course, there's some alternative treatments that can be done. Enzymes, homeopathic, chiropractic treatments, there's allergies, desensitization techniques that can be done. So the real problem is figuring out what's driving all this stuff. And yes, there are all natural alternatives that don't put your body at risk, don't put your heart at risk, don't put your brain at risk to fix the health problems. And yes, that means that you have to be willing sometimes to change certain things in your diet, in your lifestyle, and maybe give up certain things for a certain period of time and see how your body reacts to getting rid of all these allergens, antigens, all those things that are causing the reaction in you. So oftentimes the question is, are you willing to do what you need to do to fix the problems, or are you going to continue along with what you've been doing? Sick care, which is basically a whole bunch of drugs and medications, versus health care that you can do. So again, there's that same quote, if you don't make time for your wellness, you'll be forced to make time for your illness. And then I like this quote from Dr. Greenberg, who's a retired physician. As a retired physician, I can honestly say that unless you're in a serious accident, your best chance of living to a ripe old age is to avoid doctors and hospitals and learn nutrition, herbal medicine, and other forms of natural medicine, unless you're fortunate enough to have a naturopathic physician available who actually knows what they're talking about and can guide you in the right things to do. Almost all drugs are toxic and designed only to treat symptoms and not cure anyone. So basically, my point is there is more help for you out there if you're willing to look at it rather than just rely on the traditional medical approach to it. And there's some other information on all the resources where I got for this particular project that I put together. When I do these PowerPoint presentations, it takes me months to really make sure that I've investigated all the right things, so I'm giving you the right information. It's not something I just made up on a Saturday night out of my head. I investigate, I research, and I make sure that what I'm telling you is actually the true stuff. So I like to boil down all the nonsense that's out there, because it's admittedly, if you go on, anybody do a search on Google, you go to different websites, you're going to find different answers to the same problem. From 10 websites, you're going to get 10 different answers maybe. So that's our talk for today. If you have questions, there's my email address, there's our website, there's our office phone number if there's any questions you may have about any of this.